All right, so now we're going to talk about allergic rhinitis, cough, and colds. Starting with allergic rhinitis, so let's break it down. Allergic being allergies and rhinitis, inflammation of the nose, rhino meaning nose. And it can be of the upper airway, up here, in the sinus area, lower airway, which is down the throat here, and your eyes. You can get eye symptoms. Remember, all of this is connected into your eustachian tubes for your ears. This is your entire nasal cavity, which can go into your eyes, etc. So symptoms would be watery, itchy eyes, runny nose, stuffy nose, cough. Sometimes you can get a sore throat from it. Postnasal drip, if you see this stuff dripping down the back of the throat. So what kind of drugs do we use for this? Well, we use glucocorticoids, which you guys should be really familiar with it, but this time it is the nasal spray glucocorticoids. Antihistamine, oral and intranasal, which we talked about the first generation, second generation antihistamines. This would be your H1 blockers. So your Claritin, your Zyrtec, Allegra, and then your intranasal, which will Astepro, Astelin, and Patenase. Those are antihistamines that go through the nasal cavity, so we'll talk about that. Also, Sympathomimetics, oral and intranasal, and Anticholinergics, those things that dry you up. So the first choice and gold standard for treatment of runny nose is your intranasal glucocorticoid. So like your Flonase, there's Flonase, Veramist, fluticasone, which is the generic name basically for most of these. So there's a whole bunch that are out there, and a lot of them are over the counter now. As far as adverse effects, you can get some dryness of your nasal passageway and a sore throat. Other choice are oral antihistamines, which would be your second generation antihistamines are definitely recommended. Not to say that they can't take the Benadryl, the first generation, but again, it can cause fatigue. So the other ones work real well because you need it really for 24 hours at a time. So you'll take your second generation, it won't make you tired, like the Claritin, Zyrtec, and Allegra. It should be taken regularly throughout the allergy season, even if you're not having symptoms. So if you know you're allergic to pollen, dust, mold, animals, that kind of thing. So you'll end up treating it seasonally or as needed when you're exposed. As my cat is trying to bother me. So a lot of people are allergic to these things. Cats. All right, so intranasal antihistamines, that's your Astelin and your Patenase. These are around and they're used. I've used them quite a bit, and I actually like them because they're antihistamines and they work right away, whereas the steroid nasal sprays take a little bit to work, although it's definitely the gold standard and the first line, but as an adjunct, or if you're just having episodic issues with runny nose, stuffy nose, that kind of thing, the Astelin, Astepro is another name, or Patenase. The one thing is these taste really awful. So sometimes you'll take it and your food and your water will taste like that for hours. It's over 12 years old. Sometimes it can cause you to feel a little bit like somnolence, not fatigued, but just kind of, I've never felt that way with it, but it can if it's swallowed and systemically absorbed. You can get nosebleeds. Just think of something that you're putting up your nose that can irritate it. Not everybody gets that. It can dry you up and have an unpleasant taste, which I already mentioned. So your anticholinergics, another one is Atrovent. So think of that one. That is the first one that's come out. Oh wait, no. I'm like getting confused. Antihistamine, anticholinergics. I put this in red because I really want you to remember this one. So Atrovent, anticholinergic nasal spray. It's used for colds, allergic rhinitis, and it helps for runny noses. There's also intranasal Cromolyn that reduces symptoms by suppressing release of histamine and other inflammatory mediators from mast cells. Remember the histamine release with the asthma and COPD, or if you haven't watched that one yet, Cromolyn is also used for asthma. It works on the histamine. And then we have the Sympathomimetics, that's your Afrin that you're getting at the over the counter. Sorry, my cat's biting me, and I'm going to get very mad in a second. Ugh. So it reduces nasal congestion. It activates the alpha-1 adrenergic receptors on nasal blood vessels, so it constricts the blood vessels to stop it from, so it stops the congestion. But with these, you can get rebound congestion, so if people are going to use these, you have to make sure that they don't use it more than 5 days, because what happens is your body gets dependent on it. I've seen people that have been dependent on it, and they deal with stuffy noses 24 hours a day, and they have to use this chronically. It comes in drops, although the most common is sprays. So these kind of things, phenylephrine, you can get behind the counter, over the counter, but your ephedrine, pseudoephedrine, you need to get that behind the counter, and you need a signature for oral and nasal. So when you're thinking about these, think of Sudafed, anything with pseudoephedrine in it. There's many things that have combined with Sudafed that's all behind the counter. Also, like your Afrin has some pseudoephedrine. Actually, I think that's the oxazastine in it, but there's some that have pseudoephedrine in it. It can raise your blood pressure, can cause anxiety. Some people take it as treatment for allergies. But there's some combinations, which is your ipratropium, that's Atrovent, your Singulair, and Xolair. But remember, that is a monoclonal antibody, too. So, all right, cough. Antitussives. So that's like your Robitussin, your Triaminic. So those have dextromethorphan in it, which is your cough suppressant, or diphenhydramine, that's your Benadryl, or benzonatate, which actually is a prescription. That's called Tessalon Pearls. There's other ones, opioid, there's codeine and hydrocodone. So any drug for cough, so usually anything you can get over the counter except for your codeine, obviously, and hydrocodone. We try to stay away from it. Rarely will I get Tussian-X, which is your hydrocodone. There's also the Phenergan with codeine, which we talked about. That's the more common one that's prescribed. But you can also get your, like, Robitussin. Anytime you see a DM, that's dextromethorphan. You have to look at the ingredients. It sometimes can be really confusing, because you can get like NyQuil and it has about 5 or 6 ingredients in it. It's really not good to get those types of drugs, because you really should only take the ingredient that you really need. So try to remember that for your patients, for yourself. If you don't need a cough suppressant, don't get the dextromethorphan, don't get the DM, don't get the PE, which is your phenylephrine, that helps with your nasal runny nose. What if you don't have a runny nose? Then you don't really need that. So then you would just choose something that is just for that specific symptom that you have. Sometimes it's not good to mix all those medications. Your patients that have hypertension, you want to be careful with taking all of these other medications, especially these medications right here. When you're going here, your Phenergan with codeine is okay for hypertension. Dextromethorphan, be really careful with people that have anxiety, depression, that are on SSRIs, which would be like your Paxil, Prozac, Zoloft, Celexa, Lexapro, those kind of things. So anything for depression, anxiety, that can have an interaction that can cause psychosis. So that's not really good. Benadryl is fine to take, and the benzonatate pearls, they have a different type of action, like kind of anesthetize the respiratory tract. Those are by prescription only. They're used as needed, and they're pretty benign. Really no side effects to them, so those are prescribed a lot. But people say they either work or they don't work at all. All right, so we talked about cough suppression, nasal, runny nose, allergies. Now let's go to expectorants, getting stuff up. I talked about in my COPD, in the COPD slides, how Mucinex, which is your guaifenesin, is real important, because people with emphysema have that thick secretions all the time. So you want that stuff to loosen up so you can get it up. So it makes the cough more productive, stimulates flow of secretions. They have to drink a lot of fluids, and of course anybody with a cough or anything should be drinking a lot of fluids. Usually the Mucinex is every 12 hours. Humabid is not out anymore. Humabid actually went over the counter and changed the name to Mucinex. So Humabid used to be a prescription. That's your guaifenesin, 6 to 1200 milligrams. And as a prescription, we would say take 1200 milligrams twice a day. Mucinex now is the same exact thing. It comes in 600 milligrams, and they can take 1 to 2 every 12 hours. Okay, so mucolytics they react directly with mucus to make it more watery. This is your hypertonic saline, acetylcysteine, which you probably won't see, and I can't really even read this slide. It gives side effects, I see. Like watch for dizziness, drowsiness, vomiting, rhinorrhea. You're not going to really see these too much, so we're going to move on. All right, let's talk about a common cold. Usually it's a viral infection. Is it a cold or is it the flu? You'll hear people out there thinking the flu is diarrhea and throwing up because it's just typically what we were brought up with. That's the flu, and a cold is respiratory. But really, flu is influenza, which is respiratory. So is it a cold or the flu? So you can see the difference here. Is it a cold? Usually you don't have a temperature, but you'll feel achy, you'll have some sneezing, runny nose, throat hurts, and you might have a cough. But if it's the flu, it usually comes on suddenly. Like one day you start having body aches and your fever starts going up as the day goes on. You are so tired, and then you have the severe cough. You have a headache from the fever. You just do not feel well. Both of these are viral. There's the flu shot that people can get, and the flu shot, covers the last year's strains of the flu. It does not mean that you're not going to get the flu. People that get sick from the flu shot means that it's just a reaction. It doesn't mean you have influenza whatsoever. So those are just some common myths that people pass around. It used to have thimerosal in it, and people that were allergic to that would stay away from it, but now they don't have thimerosal in it. Most people can tolerate the flu shot just fine. So it is real important to get the flu, but again, you'll hear people, I got the flu anyways. Well, you got a different strain of the flu. So just to let people know that. As far as how you're going to treat that, it's basically just rest and fluids. If you have positive influenza by a nasal swab, then yes, they can give you Tamiflu. Is that the best drug? No, because it doesn't really help too much. It may take the edge off for about 1 day or shorten the duration for about 1 day, maybe 2 days at the most. But of course, when you're feeling like that, you'll take a day, right? So most URIs are viral, like 99%. Even when you hear bronchitis, let's think bronchitis, which we'll talk about it later. But bronchitis is viral. But people think, oh, I got an antibiotic because I have bronchitis, because antibiotics are overprescribed, and that's what people are used to. They think just because it gets in their lungs, they need an antibiotic, but they don't. 97% of cases of bronchitis are viral. Now, this doesn't mean not to give an antibiotic. If they have emphysema, things like that, you have to worry about their immune system, so you want to give them an antibiotic. If it's not going away after 10 days to 2 weeks, yes, let's cover for a bacterial infection. And just because someone has a fever does not mean it's bacterial. Also, just because they blow out green stuff out of their nose does not mean it's bacterial. All that means is that it was sitting in your nasal passageways for a while, exposed to oxygen, and it changes the color. That's all that means. So if you have mucus sitting in there and it turns green or yellow, you probably have an infection, but many times it's viral. You're just going to treat symptoms, bacterial, you're going to treat antibiotics. When people come in to see me, the only way that you'd really treat with antibiotics for the common healthy person would be if they have strep throat. So you do a rapid strep and treat, if that's positive, with your penicillin or amoxicillin. If it's allergies, antihistamines and steroids are the most effective. So nasal steroids are the most effective. So remember that because it's really getting right into this area where you're having the symptoms. If you take an antihistamine, that's great. Some people take both and they need to take both. But just remember those steroids are getting directly to that area. There's some over-the-counters, which we talked about, that have all of these things in here. So make sure you're reading your ingredients. So the nasal congestant, which would be your phenylephrine, which is over-the-counter, or your pseudoephedrine, which is the stronger behind-the-counter. Your antitussive, which would be your dextromethorphan. That's the DM, anything you see DM. Your analgesic, like NyQuil, a lot of times they'll throw aspirin in there, or a Tylenol, or some have ibuprofen. Be careful if it's aspirin, or be careful even if it's Tylenol, because if you're taking Tylenol on top of Tylenol, then you're taking too much. Your antihistamine sometimes is in there. It'll say like severe allergy, cough, and cold, and it'll have that in there too. And then some things will have caffeine in there. So some people can't tolerate caffeine like myself. So I'm always reading the ingredients. I don't like taking all that stuff. You want to be careful with young children. Avoid any OTC cold remedies in children younger than 4 to 6. So really what they recommend now is Benadryl, just because it's been studied. I know we say it's for allergies, but if they need something, that's what the pediatricians will usually recommend, but we try not to give any type of cold and cough stuff less than 4 to 6 years old. And that is it. So if you have any questions about this one, just go ahead and ask me. All right, take care.